Hey, Care Partners, welcome back to Memory Care with Teresa Youngstrom. So excited you're here and have some great information to share with you today. It's so exciting, your questions and your comments. I'm really enjoying all of that and giving me ideas of new speakers to bring on. And you're really, really going to love the gal we have on today. Let me introduce you to Dr. Angela Onyekanne. She is a board certified geriatric physical therapist with 17 years of clinical experience exclusively serving older adults. She's the owner and founder of Seniority Mobile Therapy Associates, a multi-disciplinary mobile therapy and wellness practice that provides services to clients in the comfort of their home. She believes in empowering seniors with the tools they need to retain their functional independence and age well in order to continue to do the things that they love. I love that. Age is just a number and does not define your full capabilities. Her mission is to fill in the gaps that are barriers to quality rehab care. She's a native of Richmond, Virginia, and has been in Cincinnati, living in Cincinnati for the last 5 years with her husband and three sons. I hope that you'll help me welcome Angela Onyekanne. Welcome, Angela.
Thank you. Thank you,
Yeah,
Teresa. I'm excited
thanks.
to be with you today.
Well, thank you for taking the time out of your busy schedule. I know you're always running and serving so many people, and I just so appreciate that. I, I want my audience to appreciate the services you're providing around Cincinnati, and so I knew I had to get you on the podcast.
Well, I appreciate you for inviting me. I'm very excited to be here.
Yeah, well, let's get to the questions because I've got some good ones for you. So, what is mobile PT and how is it different from therapy offered via, a home health agency?
So, mobile therapy is essentially taking the clinic to the client, whether it's their home, whether it's where they work, whether it's an adult daycare. It's just a umbrella term for defining that therapy can be provided wherever the client needs it. We primarily provide the services in the client's home, but as a mobile therapist in private practice, we are restricted necessarily to the home if the client has needs in other environments. And contrary to a home health agency that typically provides care for older adults when they're post acute care coming out of the hospital or even a community referral from a physician's office, they have to follow the guidelines of being homebound and it is essentially restricted to their house. But our mobile services, while we primarily do provide the services in the home, it can also be in other environments.
All right, that is awesome. So, what's been your experience providing the service, say, to older adults, specifically patients with dementia, my group of people?
Yes, ma'am. What better environment to provide rehabilitative services but an environment that is most familiar, that is routine, and is comfortable? Home primarily would fit that mold. And understanding that dementia is progressive and has multiple variables and variances in the day to day way of things, it just allows for easier access to the client if they needed the care of a rehabilitation provider, such as PTOT or speech. Um, we have had experience with multiple levels of clients suffering from dementia, even at early onset, where the condition is mild to even very advanced, when it seems that they are almost terminal. Our role is very important and is critical at any of those stages. Um, I don't I wasn't sure if you wanted me to break down the different stages and the examples of
Sure, I'd love
what
some
we have
examples.
actually done. So,
My audience loves
especially
examples.
in the case of like a higher functioning senior that has dementia, where they just received the diagnosis of mild cognitive impairment, where they're starting to notice that they're having short term memory loss, becoming more forgetful. Um, you know, the role in therapy is especially for speech therapy, is helping them to define some strategies for which they can retain those higher level cognitive skills. Occupational therapy, where they can still independently do activities of daily living, um, and showing them strategies for still being able to do that, where they're not going to have to be as dependent on their caregiver as early. And then for physical therapy, it's fall prevention. I mean, that's at any stage of dementia, but
Mhm.
for someone that's high functioning, it's definitely fall prevention is huge. Just getting them acclimated to an exercise routine, because we know there are some neurocognitive protection with aerobic conditioning exercise. So also getting them acclimated to a appropriate program for which they
Mhm.
can be exercising more. Um, to the stage of some moderate impairment, where not just that they're becoming more forgetful, but they are starting to show some signs that they are needing some more caregiver assist. And we really want to retain those higher level cognitive skills as long as we can. Home safety assessments, making sure that the home environment is safe, that they are using the right assistive equipment, and showing them at the right time so they can get acclimated to learning how to use that before it's too late. Making sure their home environment is set up to where things that are familiar to them, that they can access what they need to do their ADLs, or if they can still make a light meal, and how to, set up the kitchen environment that it's not as cluttered, and there's a lot of distractors for them being able to do that themselves. Um, as far as speech therapy goes, it's also helping them with communication skills. Usually, as the disease can progress, it's difficult to get their words out, have a intelligible conversation, be able to express their needs and wants as well. And so, a speech therapist can help with that. And then to the later stages where it appears that their mobility is really starting to wane, they're not safe to be uh, migrating around the home without some level of physical assist. It's definitely making those pertinent equipment needs, making sure that we've addressed pain, if pain is an issue, positioning, really what's going to help make them comfortable. For speech, it's about making sure they're not an aspiration risk, and that they have had some assist with a diet change if they need a swallow consult. OT to just, keep them engaged to some extent with what brings them joy, just maybe some simple activities or music therapy, just identifying some factors of their day to day that aren't causing any agitation or irritation. Just some ideas for different things that could be done for them as the disease will change. We have a
Right.
role in any point of it at any time.
That's incredible. I love it. So, do you find yourself ever coming in and the patient is the caregiver and they're the ones just
Mhm.
exhausting themselves caring for somebody who has dementia? You see that?
Yes, and that is another upside to being a mobile provider and
Mhm.
seeing a client in in the comfort of home or their desired location, for which they can access rehab care and not have to worry about whether the person that they're caring for that has dementia is going to be affected by them receiving medical care. If they typically have to go out for an appointment, unless they have arranged a caregiver to come to the home to be with their loved one who has dementia, they're having to take that person with them. And for someone that is some complications on account of the disease, they might can't sit in a waiting area for too long. They may wander. It's really not feasible to take them for certain appointments. And
Sure.
therapy is more frequent in order for it to be effective. Usually, they might have having to attend those appointments multiple times a week for a period of 6 to 8 weeks, just to throw out there an example of a average episode of care, depending on what they're getting treatment for. And to have to bring someone with them multiple times in that way can get to be very difficult. And that would negatively impact how well they're going to receive the care. So the fact that we can come into the home, the space is still familiar. Yes, we are unfamiliar to the loved one, but because primarily our business is consistent amongst providers, they're seeing the same person every time. And then they start to become familiar with us too. And because we have education and understanding about people with dementia, we can make suggestions for how to keep them calm and content while the patient is receiving the care. So it's kind of twofold. It's also that we can care for someone that has dementia, but for a spouse that needs our care, them being the caregiver for someone that has dementia, and the fact that we understand means that we can better care for them too, because we understand.
Yeah, so very important
Mhm.
because so many caregivers, they give it all, but they lose it all,
Yes.
and they don't take care of themselves, and
Mhm.
they need therapy for something, that ankle's bothering them or that shoulder, but
Mhm.
I'll get to that later, and wow, they can really, I
Mhm.
mean, I've known people to lose their own life, get sick, develop a cancer. They just, are so stressed and working so hard, but next thing you know, they can't take their person out, like you said, and they're
Mhm.
ordering pizza, and we're just not taking care of ourselves. I
Mhm.
love that about your company that you can come into the home and, create something custom for the
Mhm.
caregiver too, not just for the person living with dementia. That's fabulous. So, let's see my list here. What are some various PT therapeutic strategies that you've implemented in the home working with, say, dementia patients related to fall prevention? This is a huge one. And
Mhm.
people are gonna fall. I hate that. But
Mhm.
yeah, what do you do for what's your best advice for fall prevention?
Well, I will say this is a all hands on deck approach. Um, yes, PT can play a vital role, but it's
Mhm.
also a tag team effort with an occupational therapist too, who looks more into the lens of certain environments of the home that involve their ADLs, um, and just communicating together to address it in a way that is successful. But exclusively, primarily for PT, we're really looking at what are the biological risk factors of the patient that need to be addressed. Do they have swollen ankles? Do they have weak legs? Are they showing difficulty getting up and down from a chair, for which they would need some therapeutic exercise to address? It's also looking at just how are they getting in and out of bed? Like I said, getting up and down from the chair, to make some equipment recommendations that they could start learning to use, for which would keep them safe, depending on the stage of the disease. Once you reach a stage where you are not capable to learn anything new, this gets to be a challenge, and trying to bring in a device, something that's totally unfamiliar that they hadn't learned to use before now, could start to be more of a harm than it is a help. So that's definitely something that you got to have to think about. Definitely looking at environmental risk factors. Are there scatter rugs, thresholds that are an issue, variances in floor surfaces? Do they have to go up and down steps at all?
Mm.
Is there adequate lighting? Is there contrast on their steps? Does the stairs have railings? Um, Really looking at the home from a full lens of what needs to be addressed, environmental things that could cause a fall. Like I said, that's full blown tag team with the OT, but primarily just PT exclusively. We're looking at a lot of biological risk factors that are contributing to the fall, for which we would probably use some therapeutic exercise or activity intervention to help.
Do you typ
Um,
do you typically leave exercises with the
oh,
family?
there's a challenge in exercise prescription when it comes to people who have dementia, because in some cases it can't necessarily appear like it's an exercise. If exercise was never a part of their life, you certainly should understand what are their interests and try to incorporate it into their interests, so that it doesn't necessarily appear like it's an actual exercise, but that it's included in an activity that's meaningful. So for example, if I needed to work on someone's activity tolerance and their leg strength, and I would have them stand and try to occupy them with an activity with them standing at a counter, that meant they were distracted from my actual goal of trying to strengthen and load their legs.
Gotcha.
Um, Sometimes leaving exercises for a caregiver to do with the patient is not always doesn't always fare well, because they want to associate the caregiver as the caregiver. They want to associate the therapist as the therapist, and
It's
so
all about the relationship. You're
it can
so
be a
right.
challenge trying to get them to participate and be compliant with the exercise outside of sessions. So in that case, it may mean a higher frequency from the PT that's coming more often to help with getting the exercise done, because it might not be as feasible that is something that's going to be accomplished by with the caregiver.
Wow, brings up so many great points and why caring for people with dementia can be more difficult because,
Mhm.
we did a podcast last week called, do they know they have dementia? Because
Mm.
some have awareness and some don't. And I can see in your job coming out to care for them, some of them know they have this challenge and some do not. And I would imagine the ones that know that are seeing themselves usually, they like the attention, they're glad you're there. They might be willing to exercise and work out, but the ones that think I'm just fine, it's all your fault anyway, those can be more of a challenge.
Mhm.
I know, in my family's case, we had to blame it all on the doctor why they had to do it, not on me or not on my siblings, but blame it on that doctor saying we have to do this, and that sometimes would get her to participate. But
Mhm.
boy, you just have to play your cards right, and everybody's a little different, aren't they?
Yes, everybody's different. This is truly a form of therapy and providing care that is not one size fits all. It's very customary and takes time. I remember being a young therapist and not having as much insight and training and understanding of clients with dementia, and
Mhm.
realizing that I did not have a role. They don't want to listen to me. They don't want to do it. Well, I don't have a case here. I'm done.
Okay.
There isn't any. I will admit I was once a therapist that thought that way, and as I become more experienced and I become more vested with aging adults, especially for clients that have dementia, I don't think that way anymore. I feel like I have enough knowledge at this point that my role is significant, but also may mean having to take time. And that's why in being in this position of having started this company as a mobile therapy group, that's time that can be afforded to people. Time to try, time to trial, time to figure out and research and, you know, really try to collaborate with the other professionals and the families to get to a point of what will work. And I think some other environments in providing rehab care, that's time that's not allowed to a person that has dementia, especially in a facility-based environment, especially by way of an agency environment. It can be a barrier to really getting to a point where things can actually be done and be successful. It's just they just need time. And I think as long as what we as professionals are implementing and trying and documenting comes down to seeing some glimmer of hope and some window of success, then you walk through that door and you go with it. But it may take a while to figure that out, but it comes with understanding of the disease and the person, and realizing that no 2 days are the same, no two
Mhm.
different times of the day are the same. And we try to switch up our appointments, because Sally in the morning on a Thursday may be a totally different Sally in the afternoon on a Monday. And
Absolutely.
so it's good to have that option of variability and flexibility, because we can best assist when we can see them at different points of time to know, what's wrong and how we can help.
Yeah, I think you
Mhm.
guys are so incredibly valuable. And new equipment can be a challenge because if they don't have short-term memory,
Mhm.
then they don't remember that you brought that and taught them how to
Mhm.
use that. I have had to train a lot of families to blame it on themselves and say, "Oh my goodness, I completely forgot to get your walker for you. What was I thinking? My goodness." It's hard to get good help around here, and just be very humble, and get the walker rather than saying, "Mom, why can't you get your walker?" Okay,
Mhm.
so that's, she's gonna throw the walker across the room at that point. So, but
Mhm.
can you change it up how you're doing that for those people that don't have awareness, and just very
Mhm.
simply say, "Oh my gosh, I forgot again. We're supposed to do X, Y, and Z." And Angela said that last time she was here. I completely forgot. In order to, remind them without reminding them,
Mhm.
and try and stay on the good side. There are so many tricks to the trade, Ange,
Mhm.
and I love giving you referrals to clients,
Mhm.
because I know you bring this experience to the table, and I so appreciate that. Let's see, speech therapy, we touched
I
on
do
it just.
too. I
Yeah,
appreciate you too.
absolutely. Speech therapy, just a little, the swallow a vowel thing. It seems like that's becoming more and more popular with my
Mhm.
group of people. Tell me about that.
Especially, in later stages, because if you can't get a eye on the function of their swallow at the right time, that puts them at risk for aspiration pneumonia, which could um, be a huge medical complication.
Sure.
Um, and also understanding that, especially if they're losing weight, is their preference in food changing, the texture an issue that then would mean having to come up with some strategies for them to consume food that will limit them from progressively losing weight. So it's multifaceted. It's not just, the ability of the swallow, but also in looking at the diet preferences and changes if they're starting to lose weight. Um, is a huge role in that. And when people are in the community, they're just at home, I don't know that that is something that is really thought about as much, if they're not already under the care of a therapy group per se.
Mhm.
But it is, or that if they went in for a physical and they've dropped 10 pounds in 6 months or 20 pounds 6 months, that the question could become, are they eating? Has their appetite changed? Has it been affected by just their preferences and certain textures of food? And a physician thinking, oh, that should be a referral to a speech therapist to address that. I think that is something that we should be aware of and know that that is a professional that can certainly help, especially for people with dementia in later stages of the disease. Um, we usually only will think of speech therapy, especially in a facility based environment or if someone was in the hospital. When they're already at home and things, and that becomes a significant change. I certainly want your listeners to be aware and understand that that's a speech therapist could definitely help with that.
And choking
Oh,
is
yes.
something my father had dealt with, and we
Mhm,
just needed to make a change, and it was amazing. He wasn't
mhm,
tolerating things that were crummy,
mhm, mhm,
breads and rolls and
mhm.
crummy things were, oh, just terrible. Who knew? Who
And even
knew?
little cough after, while consuming food, but if it's is sometimes overlooked, but if it's certainly consistent, that should be checked out. And you notice it's only during mealtime,
Mhm.
or if you notice a change in their breathing pattern as a result, then that's something that should be looked at more in depth. But I just, this is, we're talking about this to allow your listeners to understand the
Mhm.
specific rehab professional that could help with that significantly.
Yeah, I
Mhm.
love that. I had a woman who, the son was great about bringing all these wonderful meals, prepared homemade meals to her home, and they were in the refrigerator. But do you know she lacked the ability to remember to open the refrigerator?
Mm.
There was just a blank there.
Mhm.
And, I went over one day and she greeted me at the door. She's very kind and, went in the kitchen and I just opened the refrigerator and started getting out food and putting it at the table, and she was ravenous. So it's
Mm.
so bizarre. You learn one
Mhm.
more thing, that for some reason her brain had this blank just to open the refrigerator and get food out, and she had lost significant amounts of weight. Oh my gosh, there's so much more to it, Ange,
Mhm.
there's so much more to it, and, I have so appreciated you too, helping so many individuals getting the right equipment. The right equipment's important.
Yes.
Do they need a
Yes.
cane, a walker, wheelchair? I
Mhm.
mean, how do most of your folks get their equipment? Are insurance companies pretty good about this or not?
Well, we're private groups, and we don't typically facilitate equipment
Right.
where the insurance is going to pay for it.
Mhm.
Um, there are equipment companies that can handle that, and we could just say, "Hey, why don't you call up this one?" Then they can facilitate all of that, but we usually don't get in the middle. I have taken it amongst myself to store a variety of things at my home base of operations, for
Mhm.
which if someone needs something and it will help them, they can just have it. You know,
Yeah. You're a
I
kind
I
person.
I hate the fact that so much ends up in the landfill and equipment is only used for a short period of time, and or people get access to something and it's not very effective, and so then it's not getting used, and then it ends up in the trash. And so where there are opportunities to receive those things, that if people are giving them away or they're throwing away, I will collect them
Yeah.
and store them in my garage, to have on hand in case someone needs it. And that way I have prescribed something, or I've connected them to a device that I have taken responsibility in knowing that it's effective and that they can use it. And so it warrant a lot of the paperwork and rules that fall with having the insurance company pay for it, especially because things are going to change. And once you are provided a device that the insurance company will cover, it could be a challenge to get an upgrade or a downgrade or either way. And so you're gonna end up having to pay out of pocket anyway.
Gotcha.
And you are only good for a device for 5 years. Well, you know, I haven't seen a walker that is used consistently every day that will last 5 years. It's going to fall
Right.
apart
Right, good
real
point.
soon if you're using it all the time and out in the community. So, I'm kind of a firm believer that I am not of the thought that a third party payer should be relied on for covering certain things when there are so many opportunities to receive those things at little to no cost, especially, through our business and my company. I keep a lot of stuff on hand that even the other therapists are welcome to use, take, try with people before money is spent to have them buy it. So we might loan it to them for a period of time. We're trialing out with them in their home. And if it seems like a success, they either will keep it or they can just buy a new one, but at least they know what to get.
Right.
Hmm.
Right. That is
Yeah.
awesome.
And I know a lot of people are sometimes told by their friend therapists to say, "Hey, I had this, it worked for me. You want to try it too?" And it's too short, it's too tall,
Yeah.
it doesn't fit their body, it's not safe. I mean, it's people think they have access to the right equipment, and it's not, for multiple reasons. And I've had to explain to people, "Hey, you actually could use a cane. You could upgrade from having used a walker. Your balance is pretty sufficient enough. Or
Mhm.
you should not be using a cane. You probably should be using a walker. And if it means using a walker, which kind of walker?" And really giving them that solid advice and understanding, and me showing them the data based on their balance and mobility and test scores, why this is the device that I am recommending for them. But this is all
Right.
part of our services. Hmm.
I just appreciate the wealth of and the depth of your experience. And I can just feel that if you were coming out to see me or one of my loved ones, that I was getting someone who really knows the business, knows the equipment, knows the therapies, knows could hone in on exactly what I would need. I'm curious, what is your circle of service? How far out do you go? What?
Well, we are central Cincinnati for the most
Mhm.
part. But my rule has always been, if I can get to the client within 30 minutes.
Okay.
And sometimes, and that's 30 minutes from my home base. But sometimes, maybe they are a little out of the way, but are close to someone that I'm currently seeing. Then I will, consider to take them on, because I can pair them with someone that I'm currently following, that um, means that while I'm already up in that area, I can help them too. But that's certainly discretionary. That's usually what my rule is. I leave it to my associates to decide what they think is reasonable. And I think on average, we try to achieve a commute time of no more than 20 minutes, average, give or take. And that's from home to the person's house. But it usually, fortunately, will work out that we'll take someone, and here comes another one, and they're usually our neighbors or close to each other. So it works out. And we didn't really talk about so much about how our services are covered. I wasn't sure if
Mhm.
you were going to ask me that, but we are Medicare providers, and we are participating providers with a patient's Medicare B benefits, which means it's an outpatient benefit, even though we see them at home. We're no
Mhm.
different than if the client had to go to a clinic that was at a brick and mortar. We bring the clinic to them and we just see them at home. So, by way of the insurance company, they know us as a therapy practice in private practice. But whether we're seeing someone in an office space or in their actual house, they know the difference in that. It's just that's our location of choice as healthcare professionals working with people at home.
I
And
love
that's
that.
totally different than a home health agency, which
Mhm.
obviously exclusively sees people at home. But the patient has to fit certain criteria for for that level of service.
Sure.
Hmm.
Um, okay, so that's good. What if my loved one, I just really want to maintain, PT? I
Hmm.
just, because a lot of times you can get a 12-week, your Medicare says, you can get 12 weeks or 12 visits or something. What if
Hmm.
I just really wanted ongoing maintenance? Can I pay out of pocket and keep you coming?
You can, but it depends on what the maintenance is for.
Okay.
Medicare has a ruling that for specific, especially chronic and neurodegenerative diagnosis, chronic illnesses that would need the skills of a therapist to maintain someone's existing condition, and need the skills of a therapist as in what would aid in maintaining your condition cannot be handed off to a caregiver or a lay person. It's that specific and exclusive to what a therapist
Right.
can do. Then it would be a cover service. But then outside of that, for people that still want us to continue outside of our episode of care, our
Mhm.
skilled episode of care, for which we determine the necessary visits, not Medicare saying, hey, you only get 12 visits or 10. It's definitely provider specific and discretionary to the provider. It's not a Medicare ruling that says X person only gets X number of visits.
Okay.
After that has been established and determined, then beyond that, the patient is welcome to self pay for continued wellness services where we're still coming in to help maintain their existing condition. So, especially for someone who has dementia, if their exercise program to maintain them, it could be put into the hands of a caregiver, but that's not going to happen because they don't want to associate the caregiver in doing that.
Mhm.
They will only do it with the therapist, then that is certainly an example of where someone could continue to self-pay for the therapist to still come and work with them.
Okay. We see that
Mhm.
sometimes. We see
Yes.
that. Yeah, they're not gonna do it
Mhm.
for the caregiver.
No, they're not.
But if Angela shows up, they know
That's
it's
right.
the plan.
And they'll do it. Hmm.
That's right, and they'll do it. Ange, this has gone too fast. So many great
They did.
ideas. Yeah, so much great
Yes.
information. I am so pleased that you were able to come on. Can you
Yes.
just before we
Mm.
have to log off, can you just tell my audience how they can get in touch with you? How can they get a hold of you? Give them a couple of ways, emails or phone numbers or whatever, because I just think this has been
Yes.
so incredibly valuable.
Thank you. Yes, I can be reached at, we have our website is www.senioritymobiletherapy.com. Our main business line is 513-799-8263. Or you can send us an email to info@senioritymobiletherapy.com.
That
And you will
is
have a prompt response with your inquiry if you are not knowing how we can help, but just want to ask. Happy to chat with you. No strings attached, just for a discovery call to explain how we can help.
well, I love that. Thanks so much for being here today. Thanks for being
Thank
a
you,
good
Teresa.
friend.
Thanks for
Yeah,
having me.
of
Thank
course.
you.
Hey, everybody. This has been Dr. Angela Onyekanne. She's incredible. And write down that information or watch this again. It's all there for you. I think she's going to be a valuable, valuable person in the care of your loved one who's progressing with their memory challenges and their dementia. Thanks again, everybody. Be sure to like and share and subscribe. So as we keep coming across great new resources like Dr. Anya Kani, that we can bring that to you and you'll know when we're putting out more information. I appreciate you being here. And as always, keep in mind, you got this.